Hi, my name is Mohammed Salama. I'm an associate professor at the University of Utah, Department of Pathology, and I'm one of the medical directors at the ARUP National Reference Laboratory. Today, we'll talk about a snapshot of digital pathology efforts at the ARUP Reference Lab. Digital pathology is an image-based information environment enabled by computer technology that allows the management of information generated from a digital slide. Digital pathology simply is enabled in part by virtual microscopy. And it involves component of scanning digital slides, ability to view slides via computer monitors, and ability to manage slides to be maintained in an information environment that allows for archival and intelligent retrieval. These components allow us to analyze, integrate, and share digital slides remotely and locally. At the ARUP, we use multitude of digital applications to serve our university and ARUP Reference Lab missions in education, clinical service, and research. In research, particularly, we apply new techniques, new and novel techniques and approaches for quantification of biomarkers using immunohistochemistry and immunofluorescence and correlating morphometry with molecular and cytogenetics aberrations. We cover the whole spectrum of the process from tissue procurement, tissue preparation, immunohistochemistry, whole slide imaging, as well as computer-based evaluation and morphometry. All of these components are overseen and closely involve our pathologists and medical directors. Examples of this new technology can be applied in fields such as myeloproliferative neoplasm. Currently now, and for many decades, the evaluation of fibrosis have been through semi-quantitative method by pathologists that lack reproducibility and sensitivity for quantifying of fibrosis. This technology allows us to also identify subtle changes in the bone marrows that may not be possibly evaluated and quantified by standard microscopic methods with pathologists. An assessment and quantification of marrow fibrosis in myeloproliferative disorder is an example of an area of development that we apply these techniques in. The most significant impact of quantitative grading of computerized methods of stromal features of myeloproliferative neoplasm would be to assess disease progression and to serially assess the impact of a therapy on marrow histology as a surrogate endpoint of efficiency of therapy. We recently have developed a method to objectively quantify myelofibrosis by color deconvolution of reticulin fibers and quantifying the area occupied by the fibers compared to the background hematopoietic marrow area. The results can be expressed in a quantitative percentile score. This new technology will help enhance our ability to quantify and identify more subtle changes in marrow fibrosis, particularly in an era with new therapy that have the potential to reverse marrow fibrosis is emerging. Virtual assessment by skilled hematopathologists, however, will remain an essential component in the diagnosis and serial monitoring of myeloproliferative neoplasm patients. Digital imaging will continue to play a growing role in our research, education, and clinical efforts. Thank you.